A recipient of Dean's Excellence in Teaching Award, Dr. Lahiri has supervised over 65 PhD dissertations. He is an elected fellow of the International Association of Applied Econometrics, Journal of Econometrics, and the International Institute of Forecasters, author of over 150 articles and books. Dr. Lahiri created the Transportation Services Index, a measure of output in the transportation sector that is reported monthly by the US Department of Transportation. He has been on the editorial boards of a number of prestigious economic journals, including Journal of Econometrics. On various assignments, Dr. Lahiri has worked with educational institutions abroad and in India. A recipient of grants and contracts from organizations such as the National Science Foundation, National Academy of Sciences, the World Bank, US, Department of Transportation, NIH, and New York State Department of Health, Dr. Lahiri currently works on econometric forecasting, business cycles, and health. Dr. Lahiri is going to present the Charles Molyneux Memorial Lecture, and his title of the keynote speech is Role of Forecasting in the Control of COVID-19 Transmission.
Little simple messages from my talk. Now, all my lecture today is based on my own personal research, so I don't want to bore you with a lot of those details, except that I'd like to give you, which I strongly believe is the role of forecasting in public health policy. Okay, I'd like to convince you that this one, right? I'd like to convince you that in any sphere of life, you have to base your decisions on subjective and objective forecasts, okay? And I'll give you an example of that. There are numerous examples of that. We just talked about, say, 100% reliability of a system, right? Fact is that no system can ever be 100% reliable. Anything you do has two types of errors. One is type 1 error, the second one is type 2 error. It is inevitable. All we can do is control them and be aware how much is the type 1 error and how much is the type 2 error. For example, say COVID inoculation, injection to avoid COVID, or a test for COVID-19. Do you think that the tests that you take are 100% reliable? Absolutely not. That test can give you a positive test when you are negative, and it can also give you negative test result when you are positive. Okay, this is inevitable in any test. It's just as a scientist, as a healthcare professionals, we have to be aware what is the type 1 error and what is the type 2 error. That is the job we have. Don't tell people that you take the test and it is 100% reliable. It is not. No test ever is 100% reliable. All we can do is be aware how much is the underlying type 1 error and type 2 error. That is why forecasting, knowing what forecasts do, is extremely important. Many of you are planning to work in hospitals, healthcare, right? Imagine how much important is testing in healthcare industry. When you do, say, image testing, say, an analysis of a biopsy, do you think those results are 100% true? Never. When you have a biopsy result, there's always a probability that it is positive when in fact you are negative, and it is negative when in fact you are positive. Okay, it's always true. Question is, how do you control those two types of errors? And this is the basic issue of forecasting in healthcare industry. Okay, the examples are abound. Now, today what I'll tell you, give a concrete example of COVID, because that's the thing that has devastated every society. And what I'll tell you a story of how a society or the healthcare professionals actually try to control the transmission of COVID. They cannot just lay there, right? They have to do something. Now, any policies that the authorities take are not based on what is happening now or what happened last 2 weeks. Thus policies are always based on what they expected to happen, what they think the transmission is going. Okay, is it increasing? Is it going down? Because different regions have different transmission rates, right? So the policies are based on your expectation and forecasts of the transmission in the near future. 1 week from now, 2 weeks from now, 3 weeks from now, and 4 weeks. So these are essentially 4-week forecasts that the public officials in India, in America, you name it, where the healthcare system is pretty developed, that they will base their analysis and public policy on the basis of that. Not what is happening now, but what they think is going to happen in 3 weeks or 4 weeks. For example, I'll give you one example. When they're thinking about masking policies or say any other social distancing policies, people don't like it, right? They think it's the intrusion in your freedom. So there's a cost and benefit. When you do complete social distancing, there's a huge cost, social cost, economic cost, mental cost, right? Yet they have to decide whether they will do social distancing. Based on what? Based on their expectation of where the transmission is going. If they think that the deaths are going to be huge, they have to do it. Okay? So that is where the role of forecasting comes in very, very important way. What I'll tell you today, I'll give you example because I work in America and I work mostly with American data. I'll give you some examples of how forecasting of COVID deaths were used in public policy in America for the last 3 years, okay? And how good they were or how they were not that good, okay? Saying this, and stay with me, I'll try to be brief and just see what was going on there. Now, we know that COVID-19 has cleaned out 3-4 million people have died. That's a huge number, okay? And even this number is highly, highly underestimated. There are countries where the death records are not kept that properly. The World Health Organization says that in Africa, not even 90% of the COVID deaths are recorded. In a place like America, it is much higher. They claim it is almost 98%. So you really don't have data. In India, there's a lot of claims that somehow India was saved from the COVID transmission, that miraculously people were saved, nothing happened. We have the herd immunity. You hear stories, but in the West, we also saw pictures of dead bodies burning in parking lots in Delhi. Okay, those, if you don't know, they were shown all over the world. Okay, that how Indian government was surprised, had no clue what was going on, what was coming. Okay, it's not a question of what was happening. They didn't know what was coming. So when the second wave came, Delta, they lacked oxygen cylinders. Remember those days? That oxygen cylinders is a simple thing. Oxygen cylinder, right? It's a simple thing, but they didn't have it. Why? Because they did not forecast it. They didn't know it is going to go up like this. So let's get ready. And if you remember, there's one city in India, Bangalore, they knew it. And they handled the case very well. And on the other hand, there's cities like Delhi, where people are craving for oxygen cylinder, which is such a simple thing in healthcare, right? They didn't have it. And do you think there's a problem now? No, there's no problem now. But the problem was there because they failed to forecast how the transmission is coming and where it is coming. Okay? So you understand as a healthcare professionals, as you are trying to train yourself in, you have to be aware that don't be passive, don't be retroactive, that what is happening last. You have to always think where we are going. So you have to act, you have to act prospectively, in future, okay? And our lives are like that, right? Those of you who are come here to training, why are you here and training, getting degree in this college than something else? Because in your own mind, you have estimated, forecasted that if I do this degree during the next 4 years, my job, my salary would be so and so and so on, right? It has to be that. You may not think that way, but implicitly those calculations have come in your head and you made a decision. So decision making that we do every time and forecasting are interconnected. You cannot separate one or the other. You cannot give me one example in life where you do something, but implicitly we have not forecasted what's the use of this decision that I'm going to make today, right? Because it's going to happen. You are getting a degree here. It's going to affect you in the next 40 years, right? 40, 50 years you'll be doing this. So right now, what you decided, what you forecasted would shape your life during the next 40 years. It's a very important consideration that we do, but very often we are not aware, okay? And all I'm saying is that you have to recognize that forecasting is a key for decision making. And we do decision making everywhere. All the recent advancements in artificial intelligence, machine learning, if you go in the core of the code, they are constantly forecasting. Everything is based on forecasting, okay? Except that they do with more data and they claim that they do better, okay? This is the only difference. So what I'm going to do now is, I'd say how in the American society, which after all is a lot more advanced in terms of doing this kind of stuff, what happened during COVID? What happened during COVID is that this is a graph of COVID deaths. Now again, data is very important. There are 3 types of data you can think of in COVID. One is the number of people dying, okay? Second is number of infections. Third is number of hospitalizations, right? Now the transmission comes first, right? Problem is that at the initial of the COVID, people are not taking tests. Even the test didn't exist. So you don't know what's the transmission rate, right? You have no clue. Except you see the hospitals are getting hit, right? There's a 2-week difference between transmission and somebody getting to the hospital. And they lack the ventilator and all that, as you know the story now. So the hospitalizations are very important to monitor when you have not much test results, okay? But the deaths is the ultimate test, because in Western societies, and I'm sure in India too, the death is a very fundamental record, okay? It comes from vital statistics, which is taken very seriously. And so in the death record, you'll see the cause of death. And very often, they will have a category called COVID-19. Even though almost 1/3 of the deaths during COVID was COVID-related, but not due to COVID. Okay? So this is amazing, that's called excess death. That is due to COVID's incidence in the society, where people are not going to hospitals, people are afraid to see the doctor, they're not treated for this, they're not treated for that, and they end up in the hospital and they die of a different disease. Okay? So those deaths were not directly COVID, but they were due to COVID. And the number of 1/3 of the excess death during COVID was due to these excess deaths. Okay, and this is a very important thing. Now, what we did is, we got the death records. That again is not written in gold letters. It almost takes 1 month to 6 weeks before it hits the vital statistics. So initially, people take the death records from hospitals. Very often, they are not accurate, because doctors just put something why the person died without really doing the analysis of what's the true reason for death. So it almost takes 6 weeks, 1 month to get the real true reason for death. So these are number of deaths in USA, as you see, starting from the beginning, say March 1920, and in like a few months, I think 13th of February, and you can see that it has stabilized the number of deaths, right? Still not zero, as some people have in this podium has emphasized. We are not over with it. I mean, this can shoot back again any time, right? Because different variants are coming up. And the challenge of forecasting is that when the curve starts going up, Okay? Can you catch it? That's the key. It's not that important that you can forecast very well here. Even a monkey can do it. But the problem of forecasting is when the curve going up or going down, if you can anticipate that. Okay? This is the key. So, and that is a problem because it is such a fast moving target, so fast moving that it is not that easy, and the health professionals or the health scientists were not really ready for it. But fortunately what happened is that in America, it's a big country, there are many really well advanced health research centers like MIT, Johns Hopkins, you know all these names, right? And they have models, okay? They have models on the basis of which they predict the transmission of diseases. Like influenza, it is very common. Okay, models for influenza transmission. A lot of people die out of influenzas, you know. So here, what they did is right at the beginning, they invited CDC, the Center for Disease Control in America, invited all companies or forecasting firms or the universities to input their forecast in a very methodical way. Okay? And what is that? That every week on the Saturday, precisely at the hour, you put in the database what you're forecasting the death transmission short 1 week from now, 2 weeks from now, 3 weeks from now, and 4 weeks from now. Okay? Near term. And you have to do all the forecasts simultaneously. Okay, not one, they won't take it. So this database got built up from the beginning, and there are almost 70 forecasters, believe it or not. They are inputting it for no money. It is just, they're interested in this, right? They want to be successful. And so all these data got built up, and a couple of papers people have written on this, and I'll come to that. And so this hub is the forecast hub at CDC. You can key in, you'll see how they input the data. In India, I think there's at least 1 or 2 universities or IITs who actually did similar forecast. Okay, not too many. In USA, this forecast have had a large number of firms, very well-known firms. I'm going to show you the names. You can see there that the most well-known name here is this IHME CARFIT. It's an organization from University of Washington in Seattle. And in the American listing, people were citing that company as the prime forecasting that they based on. Okay, but then you have MIT, you have Columbia, you have Johns Hopkins University. See, all these big firms are inputting in. That's the biggest intellectual centers of America, okay? And they're giving this forecast. Think, it's a lot of data, right? But nobody has, as of today, has really analyzed the data. How good were they? Were they any good? You understand? You have to ask this. Were they useful? Now, in economics, there have been a lot of literature on forecast evaluation. That is, if I have your forecast of the last 10 years, I can try to analyze whether it's good or bad in certain sense. And so these are the companies. And another thing I must tell you, that each of these company or university have certain models, okay? Very sophisticated models that are used around the world. And the most notable is ACIER model. Those of you who are interested in transmission of infectious diseases, you should know this model, ACIER model. It's very well known, okay? You cannot leave these classrooms of the university without knowing what this model is, okay? Now, there are many other artificial intelligence model, machine learning model, you name it. Whatever is being developed now, they have applied that to forecast COVID transmission and deaths during the next 4 months. Okay, and so people took it very seriously. And those of you who listen to the weekly briefings by President Trump, you realize that they were referring to this IHME all the time. Okay, that this is the company that we are basing. where it's going. So, okay, if you can reduce your transmission rate less than 8%, then we'll let you go in 2 weeks. So try to reduce it. That's the way they will entice the society to take the transmission rate lower, okay? That's the way they should do it. But nobody has actually analyzed how good this IHME firm was. They're very well known. I mean, they're a multinational. They do everything, okay? I'm sure they have their model in India too. You can check it out. I bet they have, okay? It's the international, okay? Very important. Now the data always, the dirtiness in the data, right? It's very complicated. So this is my data set, all the firms here. This is week by week by week, okay? And what you see is there's a lot of missing data, right? This is where they did not give the forecast. Sometimes they just say, oh, I'm doing very bad. Let me pull out of this. I'm not forecast anymore. So a lot of that happens. So you analyze, you have to be careful when there's a missing data. Any data you analyze, any area, you face this problem. Missing data, okay? Remember that. It is part of life. In textbooks, they don't talk about it, but when you do some work, you'll face this. We face that also, but I don't want to bore you with how we did it. Now, another thing is that how surprised people were with the COVID death. These are the shocks that every week they forecasted something, then the actual happened, and they're surprised. Oh, I underestimated or overestimated. And what you see is that on the average, these are the periods where everybody got surprised. They made mistake. Everybody made mistake. Okay? They could just, it was not human capacity to forecast. It's possible, right? And this is what happened. You can see the pure waves in this. Another thing is that you can forecast based with least amount of information. You say, okay, I don't have any model. If you see what is the COVID death next week, I know the death this week, right now, and I use that as my forecast. Okay? Very simple, right? It's called static forecast. There, they call the baseline forecast. That's the baseline, that everybody can move that forecast, right? By looking at today's value and make it as your forecast. All right, it should not be good, but it's a baseline. You should do better than that. And if you just take the average, it's called ensemble. I mean, this is the buzzword, ensemble. Ensemble means you take the average of everybody's forecast. And there's a theory out there, just to take the average of everybody's forecast and you'll be good. And you can see that actually the average forecast is pretty close to the actual forecast. Okay? And right now, in the USA or in Europe, this is the existing thinking that you take the ensemble. Get forecast from 10, 15 different organizations and take the mean, and that could be like buying an insurance, okay? You can play it safe. Don't worry, don't try to pick up the best one. Take everybody's average, and it's simple, and it shows pretty good results actually, okay? Now, what's next? You see the IHME Garfield, that company from Washington, University of Washington. You see that how bad they were in this period? This is the forecast, this is the actual. And they were rated as #1 forecasting company in America by White House actually. But actually there are a lot more firms, a lot better firms than IHME. But you would not know unless you plot it, okay? These are the forecast errors, okay? The forecast error means what's the difference between actual and what you forecasted. And you clearly see that some of these firms here were terrible. They were terrible. They didn't know this. For whatever reason, some firms were really bad. And you should be able to identify them. And maybe advise them, look, your model has a problem here, that you're going way off, okay? This is the forecasting scheme. And I don't bore you with the technicalities, But again, this model, what this table shows is that this is the rank, okay? If you can see this. And you can see that the forecasting capability is widely different. Some firms are really good, some firms are really bad, okay? And you should be able to distinguish it. Our analysis actually identifies, you can see that rank goes from 4 week ahead, the rank goes, way 50 to 1, hugely different and statistically significant. Another thing is that if you plot them, this is a nice way of graphing them. This is the baseline. This is the baseline where you use this PTS value, and you see who are better than that and who actually are worse than that. You see the large number of firms are in fact worse than the baseline. Imagine, they're forecasting seriously using big models, but they're actually doing worse than using the two-test value. They didn't know this, that's what is happening, but there are good firms also. And the interesting thing is that this is 1 week, this is 2 week, this is 3rd week, this is the 4th week. As you go from 1 to 2 to 3 to 4, the value of the models increases, okay? So you see that a lot more companies and universities are doing better than the baseline, okay? There are some econometric models, I don't go through them. All I'm saying here is that their performances over the last 3 years have been widely different. Some are good, admirable, some are very bad. The data hides it all. It has huge data. Unless you analyze, you will never know. And once you know some firms are bad, then you can advise that, look, your performance is very bad, check it out. What is happening with your model? Okay? Maybe there's some models have to be, parameters to be set, calibrated, and so on. So you can improve on them. So that is what is exposed from our analysis, that many firms did not do well. Consistently. It's not for 1 week or 2 weeks. For last 3 years, doing every week, and they're not getting it right. What does it mean? It means that model, there's something wrong with the model. Okay, like in a car, if it's not properly aligned, your car is crooked, right? And you're driving with a crooked car, and you're not fixing it, the wheels. It is like that. So if they know, they can fix it, okay? Again, these are some standard models of, I don't want to go through it, your lunch hour is coming up. So let me conclude, is that out of 50 professional firms in a country like America, where there's a lot of money in this kind of research, that majority of them did not do well. Okay, that's the first result. So the state of pandemic forecasting is not that good, I must tell you. They didn't very well, and they better improve it. Some forecasters are good, and we identified them, and we should learn from them, okay? Even this week in America, number of deaths can be anywhere from 1,500 to 5,000. That's quite a bit, with a huge confidence band. So it's not over, okay? But it's low. It is lying there, dormant, and it can come back. It can hit. Same thing is America, in India too. It scares me that people are not wearing masks anywhere, but it can hit the society anytime. Hopefully not. And what you see is that the ensemble forecast actually is not a bad idea to pursue. Saying this, let me stop, and if you have any questions, I'll be happy to answer. And again, another thing I must pitch, I teach in State University of New York. If any one of you are thinking of coming abroad to do postgraduate, PhD or master's, you can always write to me, and I'll see if I can help you in any possible way. Okay? Thank you very much.
Now the session is open for questions. Any questions, anyone? Any questions?
COVID-19 is a pandemic, so according to you, what action should the country with respect to economy take to face any other pandemic in future?
What lessons one can take?
When they are facing another pandemic. So how they should be ready for the next pandemic when the economic condition of a country is like the one we have,
Right.
like the one we are in.
I think, it's a fundamental question. It's a fundamental question. There's a trade-off between economics and saving life, right? You can keep the economy open, let people die, let all the elderly people die out, but your economy goes well, right? This is the trade-off, right? There's always a trade-off of social distancing and economic activity. And the society, there's no clear-cut answer to that. It depends on, as one of the speakers here talked about in psychology, right? That there are governments which are more like open type. They think, hard immunity would do everything, and don't worry, the kids would all get this thing and everybody would be good. But they kind of minimize how does it feel if one of your family members die. Okay? They don't think that way, right? They don't personalize it. And how many elderly people got wiped out? How many? How many people with any certain kind of disabilities or asthma and so on? Dangerous, right? So I think the reasonable thing to do is masking at least, right? That is not imposing. Many societies like Japan use masks for many, many years. It's nothing new. So it became a private sort of your individualism that it's my right not to use mask, right? Like smoking is my right to smoke without thinking who takes care of your health costs when you are sick. The society does it. So that's the trade-off between public health and individual rights that every society is struggling, I think. And only through democratic means that these things will get sorted out. Right?
This presentation was on COVID-19, right? What about the forecasting models for other illnesses or other disorders? Especially I'm from psychology background. So what about the now the stress-related disorders or lifestyle disorders are increasing. So can we have the similar thing for this type of lifestyle diseases or the stress-related disorders also?
Absolutely, and there are. In fact, the precursor of this COVID hub was the influenza database in CDC. There's a huge database on influenza. People don't realize that a lot of people die out of influenza, particularly elderly, every year. And that's a very serious business that the CDC takes in. And there are models of influenza transmission. These models are important when they're infectious, right? People infect. So that's where the social distancing comes in. But other predictors of, say, cancer or other diseases, asthma, there are models. They are not infectious. So their models basically are different. It would be in terms of behavioral factors, genetic factors, and so on. But there are solid forecasting models that people use in your catchment area, right? When you set up a hospital, right, in any area, people do analyze the population. What kind of population are you talking about? That would be your catchment area, right? Hospitals not stupid. I mean, they know when they institute the COVID, what kind of people they expect, right? And is it mostly elderly? Is it mostly kids, right? Is it mostly women in the childbearing, right? It depends. And the hospitals equip themselves following those population characteristics, right? And so that means what? Forecasting, right? So forecasting is very important part of hospital administration. Very important part. In America, I was talking to somebody, Medicaid and Medicare is a huge component of hospital revenues. Okay? So the federal government keeps a control on the hospital, how much they're doing it. So the hospital level, the controlling Medicaid, Medicare reimbursement is the most important thing to do. And there are large people, staff, 50, 60 people who do just this. Every big hospital. Okay? Thanks.
One and
and type 2 error when we are ignoring the error when it is exist or we are accepting the positive. Sir, my question is from which level to which we can tolerate the error while forecasting?
Yeah, this is a very interesting question. I'm glad you catch it because you know what it depends? It depends on the utility function of the user. Okay? How much type error you can tolerate and how much type 2 error you can tolerate, right? How much error, that is, you take a test negative, right? But it is positive. Or if somebody says, no, you're fine, but actually you're not. These two errors are not equally costly, right? There's asymmetry. And that asymmetry depends on the context. For example, in front of a judge, a criminal, should he go to jail, they will minimize the probability of sending an innocent person to the jail, right, at any cost. So that probability will possibly take it like 0.00001. But maybe as a result, they will let some criminals out. You understand? But in, say, testing for a positive biopsy, you know how important it is to get a positive result right? Can you imagine how costly if the test misses a positive biopsy? But it happens. It happens, it's inevitable in any statistical testing. All you want to do is be aware how much your test produces this error. Be aware and try to minimize that, but the moment you minimize it, the other error will increase. And that's where the balance takes place. You type what that depends on your utility or what you say cost function. That's the key. There's no one answer. It depends. Okay? But this is very important. Whatever you do, machine learning, at the core, that is what goes on in decision making. Understand?
Thank you, sir.
What is the role of a hospital administrator during a pandemic so that the hospital is well run?
Good point. So, a big hospital, right? Say Sloan Kettering in the middle of New York City. The smart people, they see, oh, the COVID is going up like this, right? So the oxygen cylinders or say ventilator, right? What do smart people do? They are not to say, okay, how many ventilators I needed yesterday. They will think how much I need 2 weeks from now, right? You understand? So they have to forecast what is coming and get ready. That makes the difference between a good hospital administrator and a passive, uneducated hospital administrator. That's the difference. So the best hospitals handle the cases very well. The worst hospitals, because their administrators are not aware of these things, falter. Understand what I'm trying to say? So again, the forecasting is very important. What is going to happen and get ready. Okay?